Hello everybody, my name is Eduardo Flores. I will be presenting on antimicrobial resistance. I want to thank Dr. Craig Winkleman for allowing the opportunity for a presentation like this. And let's get started. I'm going to be presenting on antimicrobial resistance with an emphasis in antibiotic resistance. Give me 1 second. There we go. Alright. What is antimicrobial resistance? So, according to the CDC, antimicrobial resistance is when germs like bacteria and fungi develop the ability to resist drugs designed to kill them. Germs survive the treatment of the antibiotic, or in this case, antimicrobial treatments, antifungal treatments for fungi, and they continue to grow and to spread. Antimicrobials are characterized on the type of organism that it acts against. For example, antibiotics are for bacteria, as stated, and antifungals are for fungi. Uh, when something becomes antimicrobially resistant, it does not refer to the body becoming resistant to the antimicrobial, but rather to the microbe itself becoming resistant. So, what causes antimicrobial resistance? Antimicrobial resistance, or AMR, occurs when an individual inappropriately consumes an antibiotic or antimicrobial while failing to effectively kill the targeted microbes. Particularly when we look at antibiotics, we see resistance to occur in a matter as so. We have an example right here. Number one is it starts with a number of germs. Some of them, before being resistant, could be already resistant to a drug, or when they're exposed to a antibiotic and they survive, they become resistant. So the same thing can happen. Then you take another antibiotic which kills the bacteria that is causing an illness, as well as the good bacteria protecting the body from infection. And then what remains are the bacteria that are drug resistant, and now they take over and they grow. They spread in the body, they grow in number, and they don't just reproduce and grow in this manner through reproduction, spreading the information of resistance, but as well to other bacteria that they can come into contact with just by literally contacting other bacteria. They can spread genetic information that will allow them to be spreading the resistant information. The use of antibiotics is the single most important factor leading to antibiotic resistance around the world. So just the fact that we have antibiotics to use is a huge reason why antibiotic resistance is a thing. Unfortunately, this is how bacteria works. It's not something that is 100% perfect, in which, they won't be able to become resistant to this drug, but in fact they do. Antibiotics are among the most commonly prescribed drugs used in human medicine. However, up to 50% of all antibiotics prescribed for people are not needed or are not effective as prescribed. So what is the importance of disabling antibiotic resistance? So each year in the United States, 2 million individuals acquire serious infections from bacteria, and 23,000 of these individuals die each year as a direct result from antibiotic resistant illnesses. Now, this number, when you divide it, statistically speaking, it's not significant, but that is still 23,000 individuals that whose death could have been prevented if resistant infections towards antibiotics were not a thing. That's 23,000 lives that could have been saved. Now, looking at this economically, the cost of antibiotic resistance ranges from as high as 20 billion in excess direct healthcare costs, with additional costs to society for lost productivity as high as 35 billion a year. Public health journalist Maureen McKenna states on a TED Talk in 2005 that the pre-antibiotic era was a time in which any injury could kill you. It is a big issue when we speak about antibiotics. When we talk about antibiotic resistance, it's not just that a certain drug or a certain antibiotic is becoming resistant. It is the fact that when these bacteria become resistant to these antibiotics, we're losing the amount of antibiotics that we could use in order to treat an illness. Now there are higher level antibiotics as well, but healthcare providers struggle to use these because if we introduce these higher level antibiotics that are very potent, then we're providing for the bacteria to learn our greatest weapons and to become resistant to that. So we're losing um, ammunition. We're losing weapons that we can use, biologically speaking, against bacteria. Uh, so speaking about the pre-antibiotic era, we see this in the case of a police officer, as stated by drug-resistant economist uh, Ramanan Laxminarayan in a TED Talk on September of 2014. This police officer received a simple minor scratch on the cheek from a thorn from a rosebush. Now, many of us have received similar cuts, and we just graze it off. It's nothing. If something were to happen, we have antibiotics, or the antibiotics are already in our systems through our food, or antibiotics that we take separately, can diminish or get rid of any possible infection. Now, in this case, in a pre-antibiotic era, this police officer, with that little scratch from a thorn bush, ended up having a lot of pus coming out of his head due to an infection that occurred from a bacteria growing and spreading. And the pus became so much that his eye became so infected and it had to be removed. And ultimately, this police officer passed away. Now, of course, um, the evolution of antibiotic resistance, it's something natural. It's not something that will be prevented 100%, but we can definitely take the opportunity to delay such an evolutionary trait by bacteria, and there are doable solutions. Um, we can teach the population to take antibiotics as instructed by doctors and never through other methods other than prescription. We can teach the population to ask questions. Uh, Many reasons why doctors give unnecessary antibiotics is because they believe that the individual wants it. There's been many cases in which doctors just suffer with individuals who keep asking and asking for a treatment to be given to them even though they're waiting for lab results or they don't need antibiotics, but yet they ask for antibiotics, and in many cases, though inappropriate, some physicians are responsible for giving antibiotics to individuals who may not need it. I went to the hospital for a checkup of a throat infection, and the doctor had taken a culture of the infection that I had and sent it to the lab. And I doubt that they had results at at the same time because as far as I know they didn't have a lab on site, but immediately the doctor gave me a antibiotic to take. Now the antibiotic was one that um, was appropriate for the strep throat that I had, and being honest, I messed up with the taking of the prescription, and now I have a strep throat that comes along every year, especially during the cold season. Just a couple weeks ago, I had it. Um, so because of my fault, I now have a bacteria that is resistant to amoxicillin. Um, and I do realize that I made a mistake. I knew about the mistake when it occurred. I had lost track of my antibiotic taking times, and in the end, I don't know what caused me to not continue taking the dosage, but I stopped completely, and now I have a bacteria that is resistant to amoxicillin. I haven't gone back to the doctor to have them prescribe another antibiotic in order for me to remove this infection for two reasons. One of them I already messed up once. I know that if I take another one, I wouldn't mess up with all the information that I know now, especially now that it's my responsibility to do things properly. But also because the infection isn't as bad as when I first had it. My body is used to it. It leaves within a couple days, as opposed to when I first had it. I was in bed the whole week with very high fever. Now I don't get fever. I just feel a little sore throat. But it's an experience that I've had, and my unfortunate contribution to antibiotic resistance. Um, so, if you're a medical professional or plan to become one, then establish medical authority. Um, the individual who's giving the prescription is the one who has the knowledge in order to give a prescription, not the patient. The patient can't come in and ask questions, as we stated in number 2. Um, Express to the doctor why you feel that you may need an antibiotic, but in the end, the lab results are the ones that matter, and the doctors are the ones that have the authority to say, yes, you have the green light to take this antibiotic or to take an antibiotic for the condition that you have. Prescription checkpoints are another idea in which the antibiotic is double checked to make sure that it is the correct one for the infection that is being used for it. Faster lab results. Before a prescription is given, it would be very, very helpful in order to have faster lab results, in order to know exactly what the doctor is dealing with, and to give an appropriate antibiotic or not an antibiotic as a response to the infection. And number 7, something that very much has to resonate with us, is to raise public awareness about the misuse of antibiotics. I'm already doing it. I have my own failures in the past, but I still preach what is the correct thing to do, which is to properly use antibiotics and to express the dangers of the consequences of inappropriately taking antibiotics. So that is the culmination of my presentation. Here are the references that I have taken. Thank you.